Hi, everyone, and welcome back to another episode of the Medeavors video podcast. Here, I interact with healthcare professionals, doctors, nurses, physical therapists across various specialties and try to get a better understanding of what training to be a professional in this space looks like. Today, I'm joined with someone who is an absolutely phenomenal doctor. Her name is Dr. Shubha Sinha, and she is a consultant breast and oncoplastic surgeon here in India, specifically in Ahmedabad. So, hi, Dr. Sinha. Thank you for giving me time.
Thank you for the invite. Thank you.
Yes, I got to know about getting in contact with you through Dr. Niharika. I had my first, you're actually second on my list of interviews. It's a fairly new project, but she was number one. And so she suggested that I would have a good experience talking to you. So thank you so much for your response. I'll get right into it and start with, of course, the basic question, which can also serve as your own introduction. Could you please describe your specialty and what your day-to-day practice looks like?
Okay. So, hello, I am Dr. Shubha Sinha, and I'm a consultant breast and oncoplastic surgeon. So, what does it mean? So, all females with any kind of breast problem, they come to me. I am specially trained in breast cancer surgeries and oncoplastic surgeries. That means that when you combine the oncological aspect of cancer surgery with plastic surgery to preserve the form of the breast. So that's oncoplastic surgery. And yeah, in my day-to-day practice, I examine patients with any kind of breast diseases, be it benign or malignant, or any kind of breast lump. And just that.
Great. So there's, of course, the common stereotype of being a physician is very tough. It's a lot of studying to do. So could you shed some light on that by talking about your journey? You can talk about your education, your residency period, any details that you'd like to share. I think we lost the connection for a little bit. There's a lot of struggles with recording the podcast on Zoom. And since this is intended to be like a program with doctors all around the world, I think it can be quite difficult from time to time. Let's have a little chat. So while she's here, I'll talk a little bit about why I started this project. I spoke about this a little in my intro video, but I'm a junior in high school and I want to become a neurosurgeon. So it's always interesting to speak with everyone. Oh, I think she's back. Your audio didn't connect, so I can't really hear you.
So now can you hear me?
Yes.
Yeah, sorry, I just lost my connection there.
That's okay.
So am I audible?
Yes, now you're perfectly audible.
So I just log out from the other device because I think I'm not able to do it from there. Yeah. So could you repeat the question, please? I could not hear it at that time.
Yeah, sure. So there's a like common stereotype that being a doctor takes a lot of time and it's a very like intensive process. So could you shed some light on that by talking about your education and your residency, how you trained basically to become a doctor?
Okay, so yes, you do need to dedicate quite a few years to become a doctor. You will see that all your, your friends from school and junior college and everybody would be, working, earning, and you're still a student. So be prepared for that. So the duration for which it took me was I joined my MBBS in 2002, and I came into the professional world in 2016.
Oh, wow.
So it was around 14 years it took. So I'll tell you how it was 14 years. So for 5.5 years is our MBBS. And then for 3 years is your surgical training in a super specialty or a specialty branch. So I did my MS in general surgery for 3 years. After that, I worked for around a year or year and a half in onco setting so that I could get used to, because I wanted to become an onco surgeon.
Mhm.
And then I did specialized training in breast cancer surgery for around 2 years. So yes, all this did take around 14 years.
It adds up, but I also think it's very worthwhile when you see the outcomes kind of coming into the real world. So the next question, and this is one that boggles a lot of medical students, why did you choose your specific specialty?
So when I was doing my MS general surgery, at that time, what we used to see was females, especially women patients. They were really hesitant to show it to, male doctors. And you would see that usually in general surgery, the proportion is really skewed. You will find more of male residents than female. So, and they would be really hesitant and they would ignore their disease because they would think that I have to go and show it to the male doctor. So they would not come. So initially, while I was training only, what we had done was in our OPD, we had started a women specific OPD. So one day we had fixed that, on this day, there would be only lady doctors, so that you don't need to, ignore your symptoms and come. And we started advertising like that. And then we saw that, yes, then patients were coming, they were not ignoring their illnesses.
Mhm.
So that led me to an idea that, okay, I should do, even if I am training in surgical branch, I should do something which has more of female patients so that they don't need to ignore their illnesses. So because of that, I came into breast oncology. Of course, we do have male patients,
Mhm.
but that constitutes only 1% part of our practice. So
Mhm.
most of my patients are female. So the thing that women all over the world, they ignore their illness, and even if they do know that I do have some problem, there's lots of taboo around it,
Right.
and they would be very reluctant to show it to a male surgeon. So
Absolutely.
that is yeah. So that was also one of the reasons why I went into a general surgery branch. And then once going into general surgery, then I specialized, especially in breast cancer, so that women don't, they don't have any hesitancy to come and show. Because really, patients do, they ignore everything. And especially in breast cancer, I don't know, there is a big taboo around the word breast itself.
Mhm.
So they they don't want to come and they don't want to show. And I'm not talking about females who are not so educated. No, I'm not talking especially about that. I'm talking about everyone.
Mhm.
Those also who are highly educated, I've seen them also ignoring their illnesses, them also not showing their breast to doctors because of that hesitancy involved. So yeah,
Right.
that was one of the main reason to, choose a surgical branch.
That's very interesting. So, what would you suggest are some factors that a general, like, say, any student should consider when they are going into picking their specialty?
Okay, so first of all, once you do your MBBS, there's a one whole year of internship. So go and work in all the branches,
Mhm.
and where you are most comfortable, choose that branch, because training for 3 years is not easy. And even if you train for 3 years in a branch which is not to your liking, then it becomes really difficult to practice later.
Mhm.
So even after 1 year, you can't decide. Many people are not able to decide even after that 1 year, because in internship, you hardly go for 1 or 2 months in a department.
Mhm.
So there is no hurry to join, because that's a lifelong decision which you're making.
Right.
So then you go and work somewhere. Suppose you're interested in gynecology, but you're not sure that I should take this as a branch or not, and I'm not able to decide in my 2 months or 1 month of internship.
Mhm.
So go to a gynec center, go to the gynec department and work there at least for a month or maybe more than that, and see if it's a good fit for you or not. So you should not be in a hurry, and you should not decide on the basis that, oh, my friend is taking that, so I should take it. Or people say that this is a good paying branch, so I should take it.
Mhm.
No, because this is a lifelong commitment. So just take the branch in which you are most passionate about.
Mhm.
Unless and until you are passionate about something, you are not going to, then it becomes a duty, like,
Right.
okay, I did 3 years of training in this, now I have to practice this. But if you're passionate, your work is never your duty. You're excited to go to work, that
Absolutely.
okay, I have to solve this case. So
Mhm.
just work in all departments and see which is the best fit for you, and then choose that. And don't follow, there should not be a herd mentality. Okay, in my batch, out of 100, around 50 people took this medicine, so I should also take. No, it should
Mhm.
never be like that. So just choose what is most comfortable for you.
Great. That's a great suggestion. Next is what is one specialty that you never considered getting into? Like it was never an option for you to become a physician in that area. Wow, the internet
What
really.
is the question? I'm sorry for the,
No, 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 I
I
understand. I understand. What is one specialty that you would never consider or you never considered specializing in? You said no, not this one.
actually, there is no such specialty, frankly speaking. There is no I thought I was a better fit for surgery, so I took it. But many people, they hate the branch. There was nothing like that for me.
Okay,
So no,
you were
no
open to
such thing.
everything.
Yeah.
Um, so, since you did your medical school in India, there's of course the fact that you took the entrance exam, the big exam that everyone talks about.
Yeah.
So, what are some tips you suggest to students who are preparing for the medical school entrance exams?
Um, First of all, they should make a routine, that these many hours I have to study. They should divide their syllabus and they should stick to that routine of reading. Otherwise, many a times what happened is you start reading that subject in which you have interest, and then you keep on leaving the other subjects.
Mhm.
But in entrance, it is not that they're going to ask you about only that subject. They're going to ask about everything. So make a routine, make a syllabus, and do your studying, be dedicated about it and do your studies. But you should also take, short, frequent breaks, because unless and until you give your mind a rest,
Mhm.
I don't think so you would able to, regain everything, whatever you have read.
Mhm.
There should be some amount of physical activity daily to keep, even for your mental health. That is important.
Mhm.
And at least one hobby should be there, and you should dedicate some time to it. Maybe not every day, once a week, but you should do something that makes you happy,
Mhm.
so that it does not become a routine that, for 6 months or one whole year, I'm just reading without any breaks. Then you exhaust yourself. So don't do that. Just stick to your routine. If you know that, okay, in this 1 week, I have to finish this much, then you'll finish it, but with frequent breaks, with following your hobby, so that it does not become a routine that, no, I am just studying without any breaks. And be relaxed. You'll be able to do it. See, MBBS in itself is a tough course. You pass that.
Mhm.
Now you're preparing for specialization. You'll get
Mhm.
it. Just be a little patient.
Great. Next is there's a lot of emphasis that's placed on research and shadowing for students, especially those going from just the regular degree to specialization. So, what would you say about that? How important is research and shadowing to a student's
See,
portfolio?
my branch, which is oncosurgery, is based on evidence.
Mhm,
It's all evidence-based medicine.
mhm,
So for us, research is very important.
mhm,
Sadly, in our curriculum, in our undergraduate courses, it's not emphasized enough.
mhm.
So once you become, once you go to a super specialty and then you start practicing and then you start evaluating, then you know that what is the importance of research.
Mhm.
So just start reading papers. Even once you are an undergraduate, start doing that, because research is a very big part. It's very important. With research only we have come so far in science.
Right.
Even in our curriculum of mbbs, it is not at all, not at all emphasized upon that research is so important, but it is. So make a habit of reading papers from now only. If you're doing your mbbs, make a habit of it, because once you join any specialized branch, all your practice and everything would be evidence based, which is
Right.
based on research. The evidence come once you do research. So
Mhm.
research is very important.
Great. Next is, I hate that I have to ask this question, but given the times, it kind of is a given. How has COVID and all these waves that a new one seems to come each year, how have they affected your practice?
It has, it has. Because in my practice, I deal in breast cases. As earlier I told you, as it is female, they ignore their disease. Now with COVID in place, what we started seeing was really late presentation of cancers,
Mhm,
because they would detect a lump. They would think, oh, it's nothing, there's COVID, and I won't go unless and until that lump started giving problem. There was pain, it ulcerated. So by the time they came to us, it would already be advanced.
mhm,
So yes, in my practice, my number of patients had reduced considerably.
mhm.
Earlier also, earlier when COVID had started, nobody had any idea how to do, what to do, how to manage. So
Right.
at that time patients had stopped coming. Then came a time when we started seeing lots of patients, but all of them were like locally advanced or metastatic.
Mhm,
So for cancer care, COVID has not been a good thing, because for those patients in whom chemotherapy was going on, they could not come to continue their treatment. And those who had, they had detected their disease at an early stage, but they could not go to the doctor with the fear of COVID around. So
mhm,
yes, lots of, I would say it did affect the practice. COVID did affect
mhm.
even personally as well, and patient care also. So it did.
Absolutely. Next is, this is sort of an interesting question. What is a stereotype about physicians in your specialty? Is there like a common stereotype?
So I would start with my, general surgery branch. There was lots of that, because the ratio is really skewed of male and female in general surgery. So the stereotype was, oh, you're a female, you should have gone to a gynecology branch or a dermat. You should not have taken general surgery.
Mhm,
And then, you do have to work a little extra from your colleagues just to show that you are capable. That is there.
right.
So it is not that it is there. So it is one stereotype that, being a female, you cannot do general surgery. But when I went to my super specialization, breast surgical oncology, thankfully there are lots of females there. So there is, in fact, lots in breast onco. So
Mhm,
there I did not have to face this, but yes, when I was doing my general surgery, I did face this stereotype that, being a female, you should have gone to a gynec branch.
so without, of course, violating patient confidentiality or sharing any super specific details, what is the rarest case that you have encountered in your practice?
Actually, many, I won't say rare, but when I was undergoing my treatment training, sorry, then not in my personal private practice, when I was undergoing the treatment, I had seen one 10-year-old kid with phylloid tumor who had been, operated somewhere outside. Whole of the breast duct, everything was removed, and surgery was not done right. And after that, I've never seen such a young patient with such a disease. So
Mm,
that was one thing which was really rare.
mm. So next is another, like I say, common stereotype about doctors in general. There's all that questioning about your work-life balance, and how it's just work, 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 and then studying, studying, studying if you're a student. So how do you maintain a work-life balance in your field of work?
Actually, it does get a little time getting used to it. So initially, yes, it was only study, 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 and study.
Mhm,
Initial years. Now, since the specialty which I chose, thankfully, I don't have any emergencies. So it's not like a gynecology branch that there would be emergency. All my surgeries are planned surgeries.
mhm,
So now I am able to, maintain a pretty good work and home life and everything. So now I'm at a good place.
mhm,
But initially, when you are, training and all, then we tend to ignore everything else, and we tend to, train and only study, study, study and ignore everything that's there. But now I'm at a better place. I'm at a good place because I don't have any emergencies. Everything is planned. My surgeries are planned. My OPDs are planned.
mhm,
So I would say now I am at a good place, but initially it was not. Till
mhm.
I had trained, it was not. It was only about work, 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 and then suddenly taking out some time for something, but it was mostly about work and studies. But now I'm at a good place.
So another question is, you mentioned you do a lot of like breast cancer surgeries. So I can assume your most common sort of condition that you encounter in your practice is different forms of um, breast cancer. Would that be a correct assumption to make?
Yes. Majority of my patients, 80% have cancer, but I do deal with benign breast conditions as well.
Mhm.
But that is only 20% is benign, but 80% of my patients are cancer patients. Yes.
Okay. Finally, I'll bring this down to the last question. What is your advice to students who wish to go into medicine or those who are currently in any stage of being in medicine?
Um, First of all, only and only and only if you're passionate about medicine, then only go for it, because it is a really difficult branch. Not only study wise, you just become isolated from. Am I audible?
Yeah, yeah, I can hear you.
Yeah. So you just become isolated from everything. You won't be able to attend any family functions. You won't be able to enjoy with your friends. Initial years when, you have to be dedicated. So only if you're passionate about medicine, then only think about going into medicine. And after that, you just get used to it. You enjoy it. And of course, once you complete your course, you can decide what how much time you want to dedicate to other things as well. But initially you have to dedicate whole of your time to only and only medicine. So
Mhm.
if you're passionate about medicine, do go for it. But if not, and be prepared to study for more than a decade. Be prepared for that, and then only go into medicine.
Yeah, very, very true advice. Rings very true. So I'd like to say a huge, huge thank you for finding time. I know there were a lot of scheduling issues on my side with the timing, but I'm really glad
No.
that we got to have this conversation. I'll end the recording now. If you could just hang back for 1 minute so I could just
Yeah.
mention a few things.